Hi, Dr. Raj here, board-certified plastic surgeon based in Dallas, Texas. Today I'm going to talk about a very interesting topic, which is Asian blepharoplasty. First, let me explain what blepharoplasty is. It's a fancy term for an eyelid lift. So you can do upper eyelid lifts, which generally remove skin, and then lower eyelid lifts generally remove the bags of fat that make people look tired. But the question is, what is Asian blepharoplasty? So people of Asian descent, they have what's called a hooded eyelid or a mono eyelid. It's difficult to apply makeup to that area, but there's some people that would like a more Western eyelid or a different shaped eyelid, which is why they pursue this surgery or want to think about it. The question is, what does the surgery exactly entail? And if they have that mono or hooded eyelid, and not all of them do, they're really missing what's called a supratarsal crease. And surgery, colloquial term for it is double eyelid surgery, but it's essentially a technique that is trying to recreate that fold or that line to make the eyelid look more Western or to have a different shape. There are a couple of techniques that have been described, and I split it into two categories. One of them is incisionless, where external sutures are used to create the line. I'm personally not a fan of that procedure because it just creates a static fold that doesn't change with eyelid movement. There's also a different set of techniques that involve making an incision where the tissues are removed or manipulated and then sutured to create that supratarsal crease or line. And another added procedure that can be done at the same time is called a epicanthoplasty. It's another mouthful. So in the middle part of the eyelid, which is called the epicanthal fold, some people who are Asian will have, you see a fold there where you don't really see like a crisp crease, and they have some tissue there that can be removed. So that's another added procedure that can be done along with the double eyelid surgery. Now, this surgery, although the techniques are different, the goals are different, the recovery is very similar to the blepharoplasties that we're familiar with. Patients typically have bruising and swelling for about a week. If there are any sutures, they can be removed in a week. The other thing to keep in mind is during the recovery period, it's important to ice the areas and to kind of keep your head elevated to reduce bruising and swelling. Overall, relative to a lot of the other procedures that are done in plastic surgery, the recovery is a lot faster. In terms of how it's done, there are some people that may do this under local anesthesia, but I personally prefer to do it in the operating room just because I feel the patients are more comfortable and I have better visualization and I can make sure that all my sutures are perfect to make sure I get the best possible result.